Hi everyone, my name is Mayela Aquino, and I would like to welcome you to our leadership training on leading with purpose and how to become an effective leader in the healthcare setting. I would like to invite you by clicking on the link to follow our presentation. This presentation will guide you through key areas essential for healthcare leadership. We'll start by examining 2 effective leadership styles and their impact on team dynamics and patient outcomes. Next, we'll discuss why self-awareness is critical for leaders and explore the skills needed to foster diversity and inclusion while upholding professionalism. We'll also analyze how personal, organizational, and cultural norms influence leadership. And finally, we'll connect these concepts to Christian principles, emphasizing the importance of honoring human value and dignity in leadership practice. These objectives will equip you to lead with competence, compassion, and integrity in any healthcare setting. Democratic leadership centers on shared decision-making and empowering team members to contribute ideas and feedback. In healthcare, this style fosters collaboration, open communication, and mutual respect. Leaders who use a democratic approach encourage staff to participate in decisions about patient care and workplace practices, which can improve morale and engagement. Research shows that such inclusive environments can reduce burnout and enhance patient safety by ensuring all voices are heard and valued. Involving the team in policy or protocol changes also increases buy-in, leading to more effective implementation. A recent study found that democratic leadership is linked to higher job satisfaction and improved quality of care in nursing teams. By building trust and fostering psychological safety, democratic leaders help teams navigate complex healthcare challenges more effectively. Transformational leadership is distinguished by its focus on inspiring and motivating staff to exceed expectations and embrace change. Leaders using this style articulate a compelling vision, encourage innovation, and support professional growth. In healthcare, transformational leaders drive improvements by helping staff adapt to evolving technologies and care models while maintaining high standards of patient care. Evidence indicates that transformational leadership enhances nurse retention, reduces turnover, and elevates patient satisfaction. For example, a systematic review highlights how transformational leaders foster a positive work environment that translates to better patient outcomes and organizational effectiveness. By investing in staff development and recognizing achievements, transformational leaders cultivate a culture of continuous improvement and patient-centered care, which is essential for meeting the demands of modern healthcare settings. Leaders who understand their leadership style are more effective in healthcare. Self-awareness allows leaders to align their behaviors with organizational goals and team needs, adapting their approach to fit various situations and individuals. In high-stress healthcare environments, this adaptability is essential. Self-aware leaders foster trust and engagement, making employees feel valued and heard, key factors that improve communication, collaboration, and patient care quality. Research by Mazzetti and Schaffelli in 2022 found that self-aware leaders had reduced staff turnover and greater team cohesion. Ultimately, knowing one's leadership style helps leaders support, motivate, and retain teams, leading to better patient outcomes. Healthcare leaders face uncertainty and rapid changes. Understanding their leadership style allows them to adapt to each team and situation, which is vital for managing diverse teams, resolving conflicts, and responding to crises. Flexible leaders foster a culture of continuous learning, encouraging staff to develop new skills and embrace innovation. Research shows that adaptive leaders boost employee resilience and job satisfaction. This flexibility also helps leaders align teams with shifting organizational goals and regulations, ensuring consistent, high-quality patient care. Ultimately, adaptability enables leaders to support their teams and drive long-term improvements in outcomes. Healthcare leaders must intentionally create environments where diversity and inclusion are part of daily practice. This begins with active listening and open dialogue, ensuring every team member feels heard and valued. Leaders need cultural competence, continually learning about different backgrounds and health beliefs. Transparency and fairness in decision-making set the standard for equity and prompt action against bias or discrimination. Inclusive behaviors like recognizing diverse contributions and using inclusive language signal the importance of diversity. According to Bradley in 2020, these practices improve team cohesion, satisfaction, and patient care. Leaders who model these skills foster respect, engagement, and professional responsibility throughout their organizations. Professionalism and diverse healthcare teams means upholding ethical standards and making inclusion an everyday practice, not just a stated value. Leaders demonstrate responsibility by setting clear behavioral expectations, enforcing anti-discrimination policies, and holding everyone accountable. Diversity education and ongoing competence development help staff address cultural differences and reduce bias. Mentoring programs for underrepresented groups support equitable career growth and belonging. Leaders should regularly evaluate diversity initiatives using feedback and data. Organizations prioritizing professional responsibility and diversity see improved morale, retention, and patient care quality. Making inclusion a standard empowers all staff and drives better clinical outcomes. Leadership styles in healthcare are shaped by personal, organizational, societal, multicultural, and global norms and values. Individual beliefs molded by early experiences influence how leaders communicate, inspire, and decide. For instance, those raised to value collaboration may prefer democratic leadership. Organizational culture, including policies and leadership examples, reinforce certain styles. Societal norms, like attitudes towards authority and gender, affect both self-perception and how leaders are viewed. Multicultural awareness is essential for navigating diverse teams, while globalization requires flexibility and openness to international best practices. Ethical standards rooted in multiple value systems guide leaders. Effective leaders integrate these influences to build inclusive, ethical teams. Effective healthcare leaders are flexible, adapting their leadership style to fit each team and situation. In today's globalized healthcare environment, teams often include members with varied cultural, religious, and educational backgrounds. This diversity requires leaders to be sensitive to different values and communication styles. Some cultures prefer authoritative leadership, while others value participation and consensus. Culturally adaptive leaders foster inclusion, improve satisfaction, minimize conflict, and enhance patient care outcomes. Leaders who practice self-reflection and ongoing learning can better navigate evolving societal and professional demands, ensuring care remains equitable, culturally sensitive, and patient-centered as contexts change. The Christian worldview teaches that every person is created in God's image, giving all individuals inherent value and dignity. Healthcare leaders guided by these principles treat everyone with respect and compassion, regardless of background or circumstance. This respect builds trust and cooperation within teams, while daily compassion shapes responses to both staff and patient needs. Leaders who act with integrity align actions with moral standards, reinforcing organizational trust. Promoting equity and advocating for the vulnerable reflects Christian teachings. Research shows that dignity-centered leadership fosters inclusive, resilient healthcare environments and better patient outcomes, fulfilling both professional and spiritual responsibilities. The Christian worldview shapes leadership through core values like servanthood, empathy, justice, stewardship, and compassion, all of which uphold human dignity. Servant leadership, modeled after Jesus, asks leaders to prioritize others' needs, empowering staff and patients. Empathy fosters understanding and compassionate care, while justice demands fairness and equity for all. Stewardship encourages ethical, responsible resource management. Inclusion reflects the Christian belief that everyone deserves respect and belonging. Compassion gives purpose to organizational missions. Research shows leaders with these values create more inclusive, ethical, and supportive cultures, enabling organizations to meet professional standards and honor every individual's worth. In summary, successful leadership is preconditioned to quality healthcare. Leaders who are aware of their styles and are able to adjust to different environments will build stronger teams and provide better care for their patients. By adopting diversity and inclusion, new technologies and professional accountability can be encouraged. Christian values and leadership practices will make sure that each one is treated with respect and dignity. And finally, healthcare executives with the ability to embrace self-awareness and adaptability and drive change through empathy can lead their organizations through progressive and sustainable changes. These are the key principles that would enable the establishment of supportive environments where staff and patients are flourishing. Thank you so much to those who attended and those that took the time to commit to purposeful and value-based leadership in healthcare.